Hello everyone, welcome back to Dr. Akorli CareBridge. I'm Dr. Akorli, and today we'll be discussing a silent but potentially life-threatening condition, a cerebral aneurysm. Even if you're not in the medical field, it's important to understand this, as awareness could be life-saving for you or someone close to you. If you're new to the channel, please like, subscribe, and share this video with friends. Together, we can help spread awareness and potentially save lives. Let's start with what a cerebral aneurysm actually is. In simple terms, it's a weak spot in a blood vessel within the brain. Imagine a blood vessel as a garden hose. If there's a weak area, it can start to balloon out, forming a bulge filled with blood. If that bulge bursts, it causes bleeding in the brain, something we call a hemorrhagic stroke. This is extremely serious and can lead to devastating consequences. Think of the aneurysm as a weak area in the brain's blood supply that can leak or burst like a fragile balloon that could pop under pressure. Knowing about these silent bubbles in the brain is key to avoiding an unexpected emergency. Now, how can you recognize a cerebral aneurysm? Unfortunately, many people may not feel any symptoms until the aneurysm is at risk of bursting. However, there are warning signs that we can look out for: sudden, severe headache, often described as the worst headache of your life. If you or someone you know experiences this, it's an alarm bell to seek immediate help. Blurred or double vision. This can happen when an aneurysm starts to press on nerves close to the eyes. Pain above or around the eyes. It can feel unusual and might indicate pressure from an aneurysm nearby. Drooping eyelid. Sometimes an aneurysm near specific nerves can cause one of the eyelids to droop. If you notice any of these symptoms, especially a severe headache out of nowhere, don't ignore it. Early detection of an aneurysm can make all the difference. Let's talk briefly about the causes. There are several risk factors linked to cerebral aneurysms. High blood pressure. Over time, high blood pressure can weaken blood vessel walls, increasing the risk of aneurysms. Smoking. Smoking damages blood vessels and raises the risk of developing an aneurysm. Genetics. If you have close family members who've had an aneurysm, you might have a higher risk. Other health conditions. Certain genetic disorders can make blood vessels more fragile. Understanding these causes can help us reduce our risk where possible. Simple lifestyle changes like managing blood pressure and avoiding smoking can make a big difference. Now, if someone is diagnosed with a cerebral aneurysm, what are the treatment options? First, observation. For small aneurysms that aren't likely to burst, doctors may choose to monitor them with regular scans. Next, surgical clipping. In this procedure, a neurosurgeon places a small clip on the aneurysm to prevent blood from entering it. And then, flow diverters. These are devices placed in the artery to divert blood flow away from the aneurysm, promoting healing and preventing rupture. The treatment depends on factors like the aneurysm size and location, as well as the patient's overall health. Early detection leads to more treatment options, which is why it's so important to recognize the warning signs and take action quickly. Why is it so crucial for us all to be aware of cerebral aneurysms? The answer is simple. Awareness can save lives. When people know what signs to watch for, they're more likely to seek medical help before a small problem turns into a crisis. In some developing countries, there can be challenges with limited treatment centers or access to specialized care. But understanding the symptoms and getting help early can lead to faster diagnosis and better outcomes, even in areas with fewer medical resources. If you're concerned about a cerebral aneurysm or know someone who might be at risk, many major hospitals and neurology centers around the world offer specialized care. If you're in an area with limited access to specialized treatment, start by consulting your local doctor, who can help guide you toward the right care. As we close, remember, your health is your greatest wealth. Taking care of yourself means never ignoring unusual symptoms, no matter how small. Early action is the key to managing health challenges like cerebral aneurysms. Thank you for joining me today. Don't forget to like, subscribe, and share this video. Spread this message. It could make all the difference to someone's life. Stay healthy, stay informed, and I'll see you in our next video.